live, y'all. I think we're live. Good evening. Welcome to another edition of Live with Dr. Dawn. I'm your host, Dr. Dawn Camila Brown, double board certified child, adolescent, and adult psychiatrist. And tonight, they're back, y'all. They are back. My super friends, Dr. Mia, Dr. Lakeisha, Dr. Creed, Dr. Kwanzaa, Dr. Jared, Dr. Jamie, Dr. Samm, and Dr. Nicole. They are back as promised to answer your questions this evening in relation to the COVID-19. We want to basically applaud and honor everyone who's on the front line, every emergency provider, every person that is basically treating someone, safeguarding our communities. Thank you to all of you. We really do appreciate your efforts, your commitment, and your sacrifice that you're making to really safeguard our world, right? We also want to make sure that you understand that these are our professional views that we're to be discussing tonight, and everyone's medical situation is different. So we definitely want to encourage you to contact your doctor for your own specific medical question. All right. Now, that does not negate you asking any questions, because we want the questions, right? We want to hear from you. That's why we're here tonight, to answer your questions. So why don't we go ahead and start with the introductions, and I will start with Dr. Jamie.
Hello, everyone. I'm Dr. Jamie, your lifestyle pharmacist, and I'm a board certified pharmacist, a speaker, a best-selling author, an event producer, a wife, and a sister and a best friend, like most women, right? And what I do is I help women who are busy juggling businesses, relationships, and careers to design the life that they've always dreamed about. So through my videos, my books, my online lifestyle academy, and my live events called the Fab Gathering, I teach them how to be fit, fabulous, and fulfilled without those prescribed pills. Thank you so much, Dr. Dawn, for having me back tonight.
Thank you, Dr. Jamie.
Hello, everyone. Good evening. I'm Dr. Jared. I am America's favorite dentist. I create healthy, beautiful smiles. I consider myself the Picasso of dentistry because dentistry is truly an art form. It's my passion. It's my gift. I'm also the CEO of the natural hair care line, Honey Envy. I absolutely am excited about providing y'all information tonight. Thank you so much, Dr. Dawn, for having me.
It's Dr. Jared.
Hey guys, it's Dr. Creed. I'm a board certified family medicine physician, and I specialize in helping overwhelmed, overworked, working wives obtain balance. Now, my balance may not be your balance, but I'm sure you do have a balance. In this chaos, you don't believe it, but you do. Through my books, my awesome Facebook group, and my event, Wifeology, I just help wives get it together. And I'm happy to be here. Thank you for having me, Dr. Dawn.
Hi guys, I am Dr. Lakeisha, your board certified OBGYN. I specialize in helping women who are struggling with life, sexual dysfunction, and self-image. Through my products, programs, and innovative medicine, I help women live powerful, productive, and passionate lives. Thank you for having me, Dr. Dawn.
It's Dr. Lakeisha.
Hello, I am Dr. Mia, your B3 specialist and board certified gynecologist. I help women suffering with weight gain, fatigue, and low sex drive improve their quality of life through my medicine, my books, my blogs, my Facebook Lives, my radio show, and my events. My goal is to help you experience your beauty balance and belief so you can always live well, age beautifully. Good to see y'all again. Thanks, Dr. Dawn.
Dr. Mia.
Hey everyone, I hope you all are doing well. I am Dr. Nicole Edwards, also known as Dr. Nicole D.O. I'm a board certified family medicine physician. I am the CEO and founder of Abundant Life Concierge Medicine and Abundant C&P. I help pastors, congregations, veterans, and anyone who wants to live a whole healthy life, mind, body, spirit, and finance, to do so through my books, my concierge medical practice, and through my trainings. I help explain chronic medical conditions in terms that everyday people can understand. Thanks so much, Dr. Dawn, for bringing me here. And hey, everybody, it's good to be here again.
Hey everybody, I am Dr. Samm Price. I am a licensed naturopathic physician, which means that I'm an expert in natural medicine. I'm also a wife and a mom, and that means that I now have the title of principal, counselor, and teacher through my #1 best-selling books, my concierge medical practice, and my live event, Vital the Experience, a 2-day wellness retreat. I help you bridge conventional and alternative medicine to transform your illness into wellness. Thanks so much for having me again, Dr. Dawn.
Thanks, Dr. Samm. And again, my name is Dr. Dawn Camila Brown. I'm a double board certified child lesson and adult psychiatrist, 2-time best-selling author, podcaster, public speaker, media influencer. I help supermoms, moms who parent children with ADHD. I help position their children to win. And I'm also a mental health strategist for elite athletes, including collegiate, professional, those who are transitioning, retired, as well as Olympians. Thank you again, you all, for joining us. And please like and share this broadcast with everyone you know, because the docs are back, y'all. They are back. And I'm actually going to start with Dr. Jamie. Dr. Jamie. So, lifestyle pharmacist, I want to start taking supplements for my overall health and wellness, but I take prescribed medications. Dr. Jamie, do I need to be concerned about any major drug interactions?
Oh, wow, that's an awesome question. And actually, as a pharmacist, I get this question quite a bit because people do want to start taking supplements to just improve their overall health and wellness and to kind of bridge some of the gaps sometimes that are present in our lifestyle and eating habits specifically. And so I would like to first say that before you start taking a supplement, you need to speak with your pharmacist or your physician. And I say that because there is the potential for drug interactions, and that's exactly what the person who asked this question was getting at. So typically supplement use is safe and effective, but there are some people that may have poor outcomes. So people that are taking multiple medications, prescription medications, people that have an older age, and people that may be suffering from decreased kidney and liver function in particular. Some of the main, I'm just going to hit a few highlights on some of the interactions. In order to take a deep dive, about a specific scenario, I'd have to do a consult with the patient, but this is just for like overall general purposes. So I'll just hit on like vitamin A, like vitamin E, vitamin K, calcium, and iron really quickly, because these are commonly found in multivitamins. And then sometimes people like to go out and take additional separate supplements of those as well. So vitamin A is in multivitamins, and you can find it individually as well. But interactions become a concern if you're taking something that's called a retinoid. And a retinoid would be a medication like Accutane, which is used for acne and even psoriasis. And so these medications can interact with vitamin A supplements and produce toxic levels. And so you should always talk with your provider or a pharmacist, as I mentioned, before you start additional supplementation with vitamin A if you're taking a retinoid product. And things you should look out for so you'll know that you're getting toxic might be if you are experiencing some nausea, some vomiting, dizziness, blurred vision, and even your muscle coordination is off, and you know that you started taking more vitamin A and you're on one of those medications. Those are some things that you can kind of look out for. Vitamin E is another one, because vitamin E is used by patients that have cardiovascular disease, for example. So I get a lot of questions. Should I take, additional vitamin E, Dr. Jamie, for my heart? And so there is some data that talks about patients that are on a blood thinner called warfarin in particular, that those patients are more likely to have an adverse reaction and have increased bleeding if they start taking vitamin E doses greater than about 800 international units. And so this medication is very important for you if you're on warfarin. Don't start taking anything else without talking to a doctor or pharmacist first, but vitamin E is one that comes up a lot. What else? Vitamin K. Vitamin K is found in green leafy vegetables, and they can also interact with anticoagulation like warfarin. And many people take warfarin. It's a medication that's been out there a long time. It's tried and true, and it's a lot of use in the market. So the thing about vitamin K is you have to eat and consume consistent amounts of it. And vitamin K is found in some supplements. Multivitamins have vitamin K in them, and even some of these dietary drinks like Boost and maybe Ensure. So it's important to be aware that vitamin K is in those things, and they can actually work against your Coumadin or your blood thinner and make your blood thicker, which can be problematic because you want your blood to be thin to protect against blood clots and heart attacks and strokes. What else? Calcium. Oh gosh, lots of women take calcium, right? To prevent osteoporosis. And so calcium can interact with some medications, and I'm just going to hit them really quickly and not take up all y'all's time. But specifically antibiotics, so like tetracycline antibiotics and fluoroquinolones. So if you are taking a calcium supplement, talk to your pharmacist about this, because you'll need to space out the timing of the dose of your multivitamin that contains the calcium or your individual calcium supplement and the antibiotic. You need to at least wait 2 hours between taking your antibiotic and a calcium containing supplement. Iron is something else that's very common for people to want to take iron by itself or a multivitamin with iron. And the thing about iron is that they also can interact with some medications like the quinolones that I mentioned, tetracycline, and even digoxin that some people take for their heart, and levothyroxine, which is taken for thyroid. So it's important to be aware of that interaction with iron. And that's all I'm going to hit for you right now. Like I mentioned, I'd have to do like a very deep dive and look at each patient specifically, but these are ones that are commonly asked about, and they're found in multivitamins. So those are just a few of the interactions to be aware of, but talk to your doctor or a pharmacist first.
Excellent, Dr. Jamie. Thank you so much. Very valuable information, especially hitting all those categories of the most common medicines that, majority of people are taking. No, really appreciate that.
Okay, you're welcome.
Dr. Kwanzaa. Hi, Dr. Kwanzaa. Can you introduce yourself, please?
Hey guys, what's up? It's your girl, Dr. Kwanzaa. I'm a board certified emergency physician, DJ, producer, best-selling author, speaker, and I got my ER hat on today. Just coming to give you guys some tidbits about communication while you have a loved one in the hospital. And I'm also kind of coming as a human being today. I got a sick relative in the hospital also, so it hits all of us. But the most important thing is, this is why you got to pre-plan. This is why you have to have your questions in order when you call the hospital. You need to have your best advocate who has got a lot of patients, who can be able to deal with, being on hold and getting callbacks, and who's probably the most sound at the time to get your questions together at one time, so that you're calling like on a 3-way call, so you can have everybody on the phone at one time and get your questions out to the providers or to the nursing staff. It's important to be mindful because they have to get in their protective gear each and every time they go into a room. So you just want to be mindful, and that's why we've been expressing over and over again about pre-planning, getting your wellness plan together ahead of time about where you're going to go, about who your provider is, what your medical conditions are, having some idea of what your level of risk is so you can communicate that properly. All of that makes a difference. But you have to remember that if your loved one is admitted for COVID-19, they will be in isolation. So it's also good if they're awake and alert, send them with a phone charger, send them with, a small amount of personal items that might bring them comfort, because they won't be able to talk to you very often. They can provide phones in the room so that they can hear your voice a little bit, maybe even voice chat if they're able. But these are the kind of things you want to keep in mind if you weren't able to talk to your loved one while they're in the hospital. Most hospitals across the country right now are not allowing any visitors into the emergency department, into the ICU settings. So you have to be mindful of that. So if you're sending a loved one who seems like they're kind of ill, you want to be prepared, bring a bag for them so that you can communicate appropriately. Be patient. I know it's hard not getting that communication that you want in the time that you want. We're all there. So, and I'm going to go take care of home. But I love you guys, and I wanted to show up for y'all. All right.
Thank you, Dr. Kwanzaa. We are praying for you and your loved ones. We're praying for you every single day and your loved ones. So God bless you, Dr. Kwanzaa. Thank you so much for joining us this evening.
Okie doke. Love you guys. Bye.
You too. Dr. Jarrett, what if I have a toothache and they're telling me that it's non-essential? How do I use, or what home remedies? Do you have any advice as far as home remedies that I can use to treat my toothache or pain?
That's a pretty good question. So listen, we as dentists are falling back. We understand that what we do right now can contribute to raising risk, right? So there are a lot of things that we want you to do at home that can possibly help you out until this is all over and you can get in to see us. This week I had maybe 3 or 4 patients call me with emergencies, but we have to understand what a true emergency is. A true emergency is severe pain. And what you can do at home, first thing that you can do at home is pain reliever in the form of Tylenol or ibuprofen. However, if you feel like you have symptoms that of COVID-19, we definitely don't want you to be taking the ibuprofen. So Tylenol will definitely be your friend. You want to definitely communicate with your dentist. Stay away from the emergency room because they're probably gonna turn you away because it's just not of utmost concern. So definitely Tylenol is the way to go. We would recommend using warm salt water to swish out with to help you out and help soothe things. You can also use a 50-50 ratio of peroxide and water to help out as well. But those are some things. I can go into a little more detail, but I don't want to give you too much because I don't want people playing the dentist at home. There's a reason why we have been trained for 8+ years to do what we do. And we really don't want you to try to do our job at home. The key is to stay at home as if you can. If you have pain, if you have swelling, then we want you to call us. But in the meantime, we want you to try to take care and really deal with the symptoms at home. If you have issues like a crown coming out, there's temporary relief that they have in the stores next to the floss on the toothpaste and toothbrush aisle. There's temporary cement that's there. But at all costs, really try your best not to go into a dental office. Definitely one thing, you just don't want to show up at the door. And secondly, you want to call an office first. For my office in particular, I'm only seeing patients of record, which means that I'm only seeing people that I've seen before. I'm not seeing new patients because I think it's important to understand that I'm concerned about my health and my safety and the safety and the health of my staff. I'm concerned about if I see you and you're a patient, you could put me at risk. I'm bringing this at home to my family. So you may have a concern, but I also have a equal or greater concern as well. So honestly, there are some dentists that are just refusing to see patients right now. And you can't be upset at that because this is real. I think one thing is for sure, it is hit home for us. Dr. Kwanzaa is our girlfriend, our friend. We have friendship of life, almost 20+ years of friendship with her. So we see the effects that it has on her. Everybody on this broadcast can probably name somebody that is close to them that is being affected by this virus. So we're taking an approach we're taking a professional approach, but we're also taking a comforting approach by being a supportive family member and friend. So as best you can, stay home, call your dentist, discuss your symptoms over the phone. They can walk you through. I walked 3 patients through things today. And most of my patients, they don't want to come in to see me either right now. So it's mutual. So I think definitely those key things are what you want to deal with at home as best you can. Your dentist may call you some antibiotics into the pharmacy if it's necessary. But other than that, we want you guys to stay home unless it is pain that is on the level of 1 to 10, like a 8, 9, or 10. And if you have swelling, severe swelling. Thanks, Dr. Dawn.
And thank you, Dr. Jarrett. I just want to reiterate her words. It's very important that you call first. So whatever medical condition that you're experiencing, if it's exacerbated, meaning it's gotten worse, or it's something that's a new symptom, call first. Make sure you call first. Thank you, Dr. Jarrett, for answering the question. I appreciate you. Dr. Cree, family physician.
Yes, ma'am.
Hi, Dr. Cree. I have a question. The question is, am I able to visit my grandparents if I tested COVID-19 negative or if I'm not having symptoms of the coronavirus?
This is a great question because I'm sure y'all have seen Alabama on the news and having all the block parties, having it's very rural. So you have cars lined up on both sides of the roads and they just kicking it. And that is no. So to answer your question, no, you should not. I spent most of my days seeing patients via telemedicine, and several of my patients are like, well, when my daughter comes by to visit tonight, I'll have them to do X, Y, Z. I said, oh, no, ma'am. I'm sure that's your ritual, but we have to stop that ritual. Like, please don't let your daughter come back tonight. Let her tell her everything that she needs to bring, all the things that you need done, and no more of that, because there is a such thing as asymptomatic people giving the disease to our immunocompromised or our sicker people. And we wouldn't want to do that. You wouldn't want your children giving your grandmother an illness without you knowing it. And so even if you've tested and you've tested negative, this is not the time to keep up with your normal routine. I'm going to say that again. This is just not the time to keep up with our normal routine. It's actually the time to sit down, to ponder things, to learn all the new technology. You know, my parents are pastors and educators, and they're on Zoom. They have Cash App. They have a Gmail, email. They are, brought up to the millennium because you have to bring your parents and grandparents up to the new millennium if you want to stay in touch with them. So my answer is no. I do not suggest that you keep that ritual. Maybe have a neighbor to, stop in and leave things on the doorstep, maybe, or you leave things on the doorstep. Have grandmama to open the window or open the screen door. You look out and say, y'all blow kisses and do your whoop Goldberg, your color purple through the window. And that's hard, because Easter is among us. This is the time of the year where family is everything. So I was like, well, what are we going to do? I mean, I love Jesus. Easter is my second favorite holiday. And I was like, but, this is more important in the vein of community and the way that we know it and getting everybody sick than waiting our turn to when we're going to be, shouting our shoes off when we can get to church. So no, my answer is no, just love your mom, love your grandmother from afar because you just don't want to get them sick.
Amen. Thank you so much, Dr. Cree. Very, very, very reputable and on point recommendation for every one of us to make. And you know what I want to add to that, Dr. Cree, like you said, this is the time to get, maybe your grandparents up to speed on new technology. So teach them how to FaceTime, use WhatsApp. We don't endorse FaceTime or WhatsApp, but these are free technologies out there that they can actually use to see you, communicate you, reassure you, and vice versa. So thanks again, Dr. Cree. Appreciate that. All right, Dr. Lakeisha. Hi, Dr. Lakeisha, OBGYN. How you doing?
Dr. Dawn.
Question comes from a new mom. So the question reads, I'm a new mom and I tested positive for COVID-19. Does that mean that I have to quarantine away from my newborn?
That's a great question, Dawn. And unfortunately, the answer is going to be yes. If you are a mother and you test positive for COVID-19, you will have to be quarantined away from your family for at least 14 days, but at least until you're asymptomatic and you're afebrile and your doctor has given you the clearance that you can return to your family. And when we mean quarantine, we don't mean that you can just go back home and just because you're in the house. You need to be isolated from your family. And if you can't do that in your house, for example, if you all are sharing one bathroom, that's not quarantine. The mother needs to be somewhere where she has her own bathroom in her own room and can stay in that room with the doors closed. Food needs to be passed to her through the door. You need to make sure you're Lysoling and wiping down counters. Family needs to be wearing masks in the house because ultimately you're going to put your entire family at risk. And so you need to be honest with your healthcare providers. I don't know if people have been watching the news, but a father tested positive for COVID-19 and lied to hospital employees and visited the maternity ward with his pregnant wife. So not only did he put his wife in danger, his newborn child in danger, he put the entire labor and delivery floor in danger and the staff. You know, if his wife had to be intubated, he put anesthesia at risk. So people, be honest with your healthcare providers. If you have symptoms of COVID, if you have been exposed to COVID, or if you have traveled, you need to be honest with your doctors and your healthcare providers, because you're not just putting healthcare providers at risk, you're putting your family at risk. And when we think about newborns, newborns don't have an immune system. So they are technically classified in that immunocompromised population. They can't fight viruses, they can't fight bacteria. And the last thing a newborn needs who's just learning how to breathe is to be infected with a virus that affects their lungs.
Thank you, Dr. Lakeisha. Now is the time, y'all, to be selfish. Seriously. I'm sorry, selfless. Selfless. Okay? Selfless. You have to put others people's safety above your own, then you have to do that. If that's not necessarily a pattern that you're practicing or used to practicing, start practicing it now. You have to be selfless. Think about others. Think about people that love you, that you love, that you have to put their safety before yours. You have to do that. All right. You have to be selfless. We do not know everything about this virus. We cannot complete that or restate that over and over again too many times. We do not know enough about this virus. So be selfless. All right. Dr. Mia, OBGYN. Hey, Dr. Mia.
Hey, how are you?
I'm good. So Dr. Mia, are there any supplements that you recommend for weight management if I am practicing social distancing and I am staying at home?
Yes, ma'am. So, this is the time when people gain a lot of weight because they're stressed, because they're not on a routine schedule, and that emotional eating just really comes into play. So, besides changing behaviors and using this as a time to build healthy behaviors, there are some supplements since you're not going to the doctor and, seeing your weight loss management doctor. So, some things you can do, like conjugated linoleic acid is one of my favorites. You usually see it on the bottle as capital C, capital L, capital A. I really like it because it helps to reduce body fat, and it also helps to increase your metabolism, and it supports lean muscle, which actually helps with your metabolism. My second favorite is alpha lipoic acid, and these are two supplements that you can get anywhere. Remember, all supplements are not created equally, so make sure whatever brand you choose is a high quality brand. But the alpha lipoic acid not only helps to keep your skin beautiful, but it helps to support your blood sugar levels, and that's huge in weight loss. So the more you can balance that insulin level out, the more fat you'll burn, the easier it is to lose your weight. And that's going to also help with your weight management in general, even if you're not trying to lose the weight. And then one of my favorites, my last favorite, 5-hydroxytryptophan. Some people know it as serotonin. You can find that in different forms. There's a great form that you can actually chew or that will dissolve under your tongue. It works really good for calming you in the afternoon, decreasing your anxiety, and controlling your emotional eating without keeping you awake. And there aren't many appetite suppressants that can do that. Calm your emotional eating without keeping you awake at night. So you actually sleep better with this, and it helps with your mood. So those are a few things that you can do outside of your healthy behaviors: eating your breakfast, counting your calories, getting that protein in, so that you don't have to feel like you're going to lose because you can't take some of the other medications you may have been taking. And I think it's great just to support weight management in general.
Yes, thanks, Dr. Mia. I am a fan of melatonin. I love it, not just because what it helps with, like you just said, but we naturally produce it. And so that gives me a little bit more ease to recommend it, even to kids, right? Kids are not necessarily as active these days. And so we want to also make sure that, if they're not sleeping well too.
Yes.
Something for kids that you recommend as well?
Yes.
Okay, awesome. Thanks, Dr. Mia.
Thank you.
Dr. Nicole. Hey, Dr. Nicole.
Hey, Dr. Dawn.
So, Dr. Nicole, there's a new trend going on, telemedicine. Can you tell us what exactly telemedicine is, how it's used, I mean, what is telemedicine?
Okay, so yes, telemedicine, it might be new to some, but it's actually been around for quite some time. There's quite a few practices that have been using it that will continue using it, and it might be the new trend. But right now, we're seeing so much of it because, like Dr. Kwanzaa was saying, we don't want people going into the ERs right now. And like Dr. Jarrett was saying, we don't want you coming in to the office if you don't have to. So what a lot of practices have transitioned to is using telemedicine. Now with telemedicine, it's kind of similar to an app on your phone, like either FaceTime or Skype or some of these apps where you can see the person on the screen and they can see you, right? It's a live app or a live program, either through your computer, through your smartphone, through an internet connection somewhere, but you can see your doctor and they can see you. Most times when you sign up for a telemedicine appointment, they will send you a link. That link often has a password in it to make sure that it is HIPAA compliant and it's password protected so that only you and your doctor or whoever else you allow to come into that appointment will be there. Okay, so we make sure that there's no hackers, but we will see you on the screen. Now, there are certain things that can be done through telemedicine, and then there's some things that can't. Of course, we can't touch you through the screen, right? So we can't actually take our stethoscopes and listen to your heart or lungs if you're at home. Now, there are some practices, and most places aren't doing this right now, but there are some practices where, like if you are remote or in a rural area where you can go into an office, not now, but this is just in general, you can go into an office and they can use a digital stethoscope and then your doctor can hear that way. But right now with COVID, let me tell you how things are working. With COVID, we're not able to hear you with our own stethoscopes. We can't lay our hands on you. So we will sometimes use you to feel some things. Like we'll ask you, can you feel and see if you feel any lumps on your underneath your chin? Those are called glands. Or we'll see, can you feel your lymph nodes? Are they swollen? We'll ask you things like, can you open your mouth and put your mouth right up onto the screen so we can look down your throat, right? Or we'll ask you, we'll show you how to take a pulse and we'll get your pulse rate. Or we'll ask you, do you have a blood pressure cuff at home? Can you give me your blood pressure, all right? We'll time you and see how many breaths you're breathing per minute. So these are some of the things that we'll do. We'll even have you like push on your stomach and say, is your stomach hurting on the right side or on the left side? And based off of these things, we can kind of get an idea of what may be going on. And then we can tell you what the next step needs to be. Right now, there's a lot of practices doing COVID screening on telemedicine, all right? There's even some practices that are doing it at a discounted rates. There's lots of insurance companies right now that are covering COVID screening through your doctor's office. And you can probably just go to any search engine and you can find a doctor in your area that is doing COVID screening. What they're going to do on that screening, they're going to find out your history, find out if you've traveled, find out if you have a fever, find out what symptoms you have. If you have the classic symptoms, which are starting to be pretty broad now, but things like cough, sore throat, loss of smell, loss of taste. If you're having GI symptoms like diarrhea or nausea or vomiting, if you're having dizziness, if you're having really bad fatigue. So we'll go through these screening questions with you, and based off of your answers, we'll kind of can lead you as to what you need to do, right? So the options are going to be, we're trying to see if you qualify to be able to go to the ER, right? And if you do, a lot of times what we'll do is we'll call ahead to the ER and give them a heads up. Hey, this patient meets the criteria. We probably need to be tested. They probably need to have further testing done, like listening to their lungs or a chest x-ray or get a pulse ox, right? Or if you have milder symptoms or you're or not as symptomatic or not bad as symptoms, we'll tell you what some things are that you can do to kind of hunker down at home. And then if you get worse, you can call back. So that's kind of the trend of where telemedicine is and how we're using it right now with COVID, and just some background information on it, Dr. Dawn.
No, thank you so much, Dr. Nicole, because I do believe, and I believe most of you probably would agree with me on this, that medicine is going to change after all of this is over, right?
Oh, yeah. Oh,
You
yeah.
know that telemedicine is probably going to be a huge part of that continuation of providing care.
Right.
So,
well, you got to think of telemedicine as what I call it to my patients is convenient care, right? So if you're going to come in for a blood pressure check and you're going to write down your blood pressures over the last 3 months and bring it to me, and I'm going to read it and say, oh, these look great. Let me refill your medicine. Did you have to come in and spend a whole hour and take a whole hour off and sit in the waiting room for 20 minutes and then sit in the doctor's office for another 20 minutes before I could even get in to see you? Nah, you can just send those to me through telemedicine. I can look and say, oh, great. See you back in 3 months on a telemedicine platform. So I call it convenient care. So that's where we're moving, I think, when we move towards telemedicine.
Thanks so much, Dr. Nicole. Very great answer. Thank you. Appreciate
Donna.
well the explanation of telemedicine. Dr. Samm.
Hello, hello, hello.
Dr. Samm, so the question is, I have a fever. How can I treat that without medicine? But I want to kind of preface that question. What should I do if I have a fever, first of all? And then how should I treat it? Can I treat it without medicine?
Yeah, well, first of all, it's interesting to me that a lot of my patients don't have thermometers. That's first of all. So I'm going to say this right now. Now is the time to get a thermometer. I know that they're kind of like in popular demand right now, but you want to have a thermometer at your house. It's just really, really important that you be able to take your temperature. So as a naturopathic physician, our naturopathic physicians in general, we treat fevers in stages. So if your temperature is 99 to 102 degrees, we will normally use something called homeopathy. I'm not going to get into that right now. I'm going to do just stuff that you have at home that you can treat the fever yourself. So normally I think everybody thinks, oh my gosh, what am I supposed to do? I can't take this ibuprofen, right? Which is a fever reducer. You also really shouldn't probably be taking the Tylenol either. It's an antipyretic as well. It decreases glutathione, which actually helps with oxygen in your lungs. And we know that COVID specifically targets the lungs. So the ibuprofen specifically, they said, is because of the COX-2, which actually produces renin. And we know that this is a renin-aldosterone angiotensin system affecting the kidneys and your heart, right? So we don't want to take either one of those. So what do we do? So if it's 99 degrees to 102 degrees, I'm going to suggest you do something called warming socks. So what it is you have a thin pair of socks, like trouser socks, and you're going to wet them in cold water and wring them out really, really well. And then you're going to put them on warm feet. Your feet absolutely have to be warm. You're going to put the cold, wet socks on your feet. You're going to take a pair of preferably wool socks, but not everybody has wool socks. So 2 pairs of tube socks, very thick socks, put them on top of that. That usually will reduce your temperature by 1 degree. And if the body is ready to decrease the fever, it will break the fever, believe it or not. This also helps to ease pain. A lot of times when we have a fever, we have body aches. It helps to ease the pain. It also allows you to sleep. So oftentimes I'll tell people to do these, what I call the warming sock treatment at night before you go to bed. For kids, we call it the magic socks, because what happens is when you wake up, the socks are dry and your feet are warm, and that sock is also warm. So we call it magic socks for kids. If the fever is 102 degrees to 103 degrees, so the other thing you can do is also cover your abdomen. You need to take a hot shower for about 5 minutes or so and cover your abdomen from the top all the way down to your abdomen with a cold, wet towel. And then you're going to put a wool blanket on top of it, and you're going to let it sit for 20 minutes. So what happens is your body says, I'm cold, and it starts warming up the cold towel, which reduces the fever. But it reduces the fever in a way in which that it supports the body. The fever is so important because it's the body's way of burning off the infection. So it's your body's inherent ability to heal itself. It's a symptom of something's going wrong, but we don't want to suppress it. If the fever is over 103 degrees, and this is where everybody gets freaked out about febrile seizures and things like that. If it's over 103 degrees, we do something called a Spanish mantle, and it's a wet sheet where we actually warm the body first about 5-10 minutes, and then we take a wet sheet and we cover it around the entire torso. Then you cover it with wool or a really large blanket, and you're going to let it sit until that towel is warm or either dry. This decreases the temperature by at least 2 degrees, or it actually breaks the fever. Another important thing to do is if the fever is over 99 degrees, and most of us, like 99 degrees is like what? But if you have a temperature over 99 degrees, you really should be fasting. You shouldn't have anything but water to drink. And the reason for this is because your digestive system and your immune system are having to compete, and they really don't. The immune system takes over and digestion stops. So if you're eating when you have a fever, what happens is the food putrefies in your gut. And when it putrefies, that creates toxemia. Toxemia has bacteria, and then the bacteria needs to be, you have to have the immune system get rid of the bacteria, and we don't want to be doing that. So you need to have water. Once the fever breaks and it's right over 99 degrees, then you would do an electrolyte broth, which is carrots and celery and water. Then the kidneys are prepared to take on the nutrients from any meats or vegetables or any of that other stuff. So there's an electrolyte broth that we do, and then you can start eating again. But I implore you guys, please fast and have water when you have a fever. It's important so that your immune system can take over and do what it's meant to do.
Wow, thank you so much for that, Dr. Samm. So I know in the process of kind of tending to the fever, should people be calling their doctors as well?
Absolutely. We want to know that you have a fever. That's actually one of the symptoms of COVID. So we need to know that.
Yes, I've spoken with quite a few individuals who've had fevers and they just wanted to pass. And they were allowing it to pass for a couple of days, and it's
No,
still
call immediately. Immediately. At 99, call. Call at 99. Don't wait.
Thank you so much, Dr. Samm. Appreciate that great response. So the question for me was, I haven't heard much about mental health as of late in the news in regard to COVID-19. Can you provide information on your thoughts are in regarding to mental health's relationship with COVID-19? I think that's a very good question, because when you think about the risk factors that are in play here, you think about our health, you think about employment or job security, finances, shelter, the lack of activity, potentially, relationships, safety, our way of practicing our spirituality, as well as grief and bereavement. All of those factors can play on a person's mental health. The unfortunate case is that realistically, we have not begun to experience the impact of mental health, not at its heightened level. And I don't want to be grim, I just want to be realistic. In order to identify and also prevent mental health from becoming a problem, I want you to remember two things. We have to prevent it and we have to treat it. Okay, so I'm talking to those who have mental health conditions first. If you have pre-existing mental health conditions such as depression, anxiety, PTSD, those are very common, especially to be worse during times such as this. And depression being the most common condition in our world in regards to mental health, the great thing about depression is that it can be treated and it can be prevented. All right, but we have to also think about the factors that cause depression. Genetics, for example, brain chemistry, substance use, medical conditions, right? Stress, poor nutrition. Those are things that often can cause and result in depression. But of those 6 things that I mentioned, do you know you can actually control 5 of those 6 things? So I want you to make sure that we treat this, but we also can prevent these. So when we talk about genetics, unfortunately, that's something we cannot change, but it is something that we can be well educated about. Now is the time to have those discussions with your family. Does anyone in the family have a history of depression, a history of mental illness, a history of hospitalizations? Or is anyone taking medications or have a history of medications? Substance use is a part of that as well. Oftentimes we actually drink, and we may drink socially, but sometimes, our social is now at our home. And some of us may have difficulties in separating the two. So these are some questions and some conversations you should be asking. It's time to stop, to stamp out the stigma, you all. We have to break down the stigma. The stigma can be no more, because this is really real. And mental health conditions, again, have not peaked. They usually peak after something has happened. And so I foresee that a lot of mental health and conditions, disorders, treatments, complaints will actually come after the peak of COVID-19 in the United States. We want to also think about brain chemistry. So if you have pre-existing condition of depression, take your medicines. Make sure you attend your appointments regularly. Call your physician. If you feel that these symptoms are getting worse, you want to be proactive, not reactive. We think about medical conditions. Make sure you take your medications for those as well, and make sure you keep up with your doctor's appointments, and also sleep and appetite. I'm going to say sleep and appetite and all of these things, because sleep and appetite are things we have to do, right, as human beings. And it's important to get good, proper hygiene of sleep, as well as your food intake, and what you're eating does matter. Substance use, again, some of us may have pre-existing genetic conditions for substance use, or may actually may be one of our own risk factors. So it's something that I would not keep in the home. You know, this is something that I would not purchase at the store. You should be at home anyway, and not even delivered to your home, because I heard there's apps out there too that now deliver alcohol. So you want to be mindful of these things as well. It's not for you, for your family. The lack of activity. We often think about physical activity, and there's great creative ways that we can be active within our home, with our family, making ourselves accountable. But don't forget about mental activity as well. Meditation, prayer, scripture reading, affirmations. Keeping a positive mind has shown some research to actually lead to healing, lead to positive outcomes, just by thinking things through with a positive outlook. So you want to make sure you feed your mind with positivity. And that also is the opposite. You want to limit the negativity as well. You know, limit the conversations that are negative in nature, limit the TV going on and on about COVID-19, limit your reading if it's a lot of negativity. Just do it in, you know, measures. Pick a couple of times a day when you're going to catch up on the news for information and for guidance, but not to cause you to ruminate about what's going on in our society, especially because the news changes every day. And sleep and appetite, cannot stress that enough. You want to make sure you get proper sleep hygiene, as well as choosing your meals wisely. And so, yes, take your supplements, take your vitamins, take your medications, but also be mindful of what you're eating, when you're eating it, and exercise, exercise, exercise. That is so important. So prevention and treatment are things that I want you to think about. And it's okay to not be okay. You know, a lot of us have to accept that in order to even lead us to the next step into asking for help. So you're not here alone. It's okay to not be okay, but knowing that, act on that and ask for help. All right. And I saw a question as well in the comment section. I want to go ahead and address that question. If anybody else want to address the question and chime in, please feel free to do so. The question is, it's so hard trying to cope through all of this COVID mess while in my 4th year of college. I constantly hear, talk to me if you need to, by my professors, but I just feel there's no point because they don't understand me and it sucks. Any specific tips or advice for me as a Black woman? Thank you. Well, Shanice, we are praying with you and we're praying for you. It does suck. And I like, you know, that I can't find a better word. It sucks that it's your senior year, that this is your final year of college. This is the year that many people want to make sure, you know, they're just like partying or taking less classes. They're the time of year they're enjoying the last moments with their colleagues or friends. But I do want to just, you know, answer your question. One of the things that I do recommend is find someone that does get you. If that's a mom, if that's your father, if that's your friend, you want to actually talk to someone that knows you and you feel gets you, because that's the person that's going to also check up on you, the person that's going to, you know, tell you when you're wrong or guide you to the next step if they can't help in a certain area. Be open to talking to those people. And I would actually, you know, think of more than one person. You always want to have a plan B and C. So have your 3 people and make sure that you communicate with them now. Don't wait until something is happening to where you're trying to reach them and communicate with them. Sounds like there are some concerns that you have about how things are going, and you're right. This is a time of year where it should be joyful, and it's not necessarily joyful for everyone. So talk about that now. Talk about what concerns that you have about, you know, what's going on in your life now. Don't wait until it's, you know, it's something that's out of control or it becomes something that is hard to control. I recommend having ongoing conversations, and I recommend planning these conversations. Friday nights with my sisters, for example, is something I look forward to. And I look forward to those moments, having a glass of wine and just talking to my girlfriends. And those are times, right? So plan these, schedule out these times with those three people that you know that get you, and communicate with them. Does anyone want to add anything else to that?
Dr. Dawn, first I would say what my grandmother would say is, this too shall pass, and it's a blessing in disguise. So what I would say is take this time and reflect. If you're a senior in college, then come this fall, your life starts, whether you're going to graduate school, medical school, or dental school. And if you're going to graduate school, baby, this is a time that you should be blessed to have, because your life is about to change. And if you're about to enter the workforce, so use this time to do a 5-year goal, a 10-year goal. Women are amazing creatures. Like, we're wives, we're mothers, use this time to focus on you, meditate, plan your future, start a business, do whatever it takes to bring you happiness and, to focus on your goals. I know it's a sad time, unfortunately, for high school seniors and college seniors, but God never gives us more than we can bear. Even for us women who are already finished with dental school, medical school, this is a difficult time for us as well. But guess what? We're focusing on businesses. We're thinking about ways to make money. We're thinking about other ways to supplement our incomes. So just like you, this is a difficult time for us as well, but we're being positive. We're taking advantage of this time at home. We're doing Facebook Lives, educating the community, but in the background, we're still focusing on business. And that's the advice that I would give you.
Excellent, Dr. Keisha. Thank you. Thank you. Anyone else want to chime in?
First of all, I just want to say, Shanice, congratulations. Really, think about all that you have been through, all that you've gone through, and you're here, you're about to graduate, you're about to get, because college really is, you don't feel real life until it's done. So congratulations for what you are about to embark upon. And I just want to piggyback on what everybody else is saying. We want you to celebrate the good. Look at that glass as half full. Am I saying that right? I'm sorry. Okay, all right. Look at the glass as half full. You have so much to celebrate. And just like Dr. Lakeisha says, like, we on this broadcast, we are a group of women that, me personally, I've been in my own business for 10 plus years. And guess what? I'm not stressed. What will be is going to be. And so you have to just simply embrace the moment and be able to deal with what you can deal with. Pray about the things that are challenging to you, that you struggle with, and find that support system. But listen, you have accomplished so much, and your future is so bright because you're about to get that degree, boo. Okay? And it is simply up from here. So we celebrate you immensely because we have all been there. And we are so happy and excited for all the great things that you are about to get into and accomplish.
Amen. Amen. I know it's 9:00. Does anyone want to add any last comments for our viewers?
Can I just give Shanice one more bit of advice? Shanice, make sure that you remember that you were built for this, that even though I'm not sure your religious background, but even before college came, God knew that you were going to be faced with this. And just remember to write your affirmations down. Put them on your wall, put them on your mirror, and affirm yourself every day that, I'm the bomb, I'm a boss, I'm a this, whatever you are studying. If that's, biology, I'm a biologist, whatever it is, affirm those things. And sometimes we look to other people to affirm us when we need to be in the mirror affirming ourselves. So good luck.
I love it. Yes, yes. Dr. Jane?
Dr. Dawn, I want to add one last thing if I can. And this is for the high school and college graduates and their families. My husband is a high school principal, and so I'm in constant conversation with him and kind of hearing some of the conversations that he's having with his colleagues about this whole celebration season that is supposed to be about to take place for students. And it's a special time for parents and families and students as well. So I know it does suck that, proms are planned and graduation, brunches and dinners and parties, are planned and they're having to be postponed. I just want to encourage everyone out there that think of this as something that's being postponed. We will come through this. You will have an opportunity to celebrate. So maybe in the interim, we have to do something more creative and do something virtually. Still put on our dress, get dressed up, let mom help you with your makeup, whatever that ritual was going to be. Still do that even if the prom or the celebration or graduation dinner is going to be delayed. And you can still share that moment virtually with friends and family. You can do a Zoom and reveal yourself to them. You all can do like a family dinner party via technology. We still can find a way to celebrate it now and then just hold on to the optimistic view that we will be able to get together and really turn up after all of this is over.
Hallelujah. I know that's right, Dr. Jamie.
So real quick, Dr. Dawn.
Yes, please.
I was going to say this one thing, and then Dr. Jamie jumped in with her beautiful self and took it. But I was going to just say, Ms. Shanice, delayed does not mean denied, okay? And that is, you have to look on the screen here, and I can attest for myself that I didn't get through. I had to repeat some courses in medical school. I had to take some board exams a couple of times. I had to do some things a couple of times. But listen, it was delayed, but it was not denied. I am still here where I am today. Like I said, a board certified family medicine physician. And I'm telling you, even though your graduation is delayed, even though prom might be delayed, even though things are delayed, it's going to happen when it's supposed to happen and at the right time that it's supposed to happen. I can remember when I had my child was 6 weeks early, and my dad told me, my dad is a pastor, but he said it was the fullness of time. And so even though we don't know what's going on in our lives right now, it's the fullness of time. And so delayed is not denied. Be encouraged, my dear. Congratulations to you. You have made it, and we will celebrate with you. And on the other end, right? But just remember, delayed is not denied, and we give you encouragement, and we celebrate with you.
Amen. I like that, fullness of time. Yes, indeed. Well, thank you, everyone. Thank you for the doctors. Thank you, our community, for chiming in to get your questions addressed. We really, really appreciate you all. And we hope that all the things that were discussed today, that you please pass along to your communities. Please continue to have these discussions, even in your own homes, right? And we are always here for you. So ask away, ask questions in the comment section. You have a variety of specialty providers that are here today, and we would love to take your questions. Thanks again, Dr. Kwanzaa, Dr. Mia, Dr. Lakeisha, Dr. Creed, Dr. Jared, Dr. Jamie, Dr. Samm, and Dr. Nicole. Until next time, you all take care, be safe, stay at home, right? You take care. Bye-bye. Good night.